My name's Betty Fitzgerald, and what brought me to the doctor was pain in my left shoulder. Excruciating pain that I had for, every hour of the day I was in pain. Couldn't sleep, couldn't get comfortable. The first day I seen Dr. Farrell, I was in terrible pain, which I had been in for several months.
Betty is a 78-year-old lady who came in complaining of chronic shoulder pain. She had been appropriately managed with multiple cortisone injections, physical therapy, activity modification. But this shoulder pain had really progressed to the point where she was just quite miserable. She had difficulty washing her hair, she had problems sleeping, the shoulder would wake her up at night. She was really symptomatic from this. X-rays showed that she had bone-on-bone arthritis or osteoarthritis of the shoulder. And if you think about the shoulder as a ball in a socket, the ball is the top of the arm, which is the humerus. And so the humeral head, which sits on the socket, which is the glenoid, or part of your shoulder blade, she had, over the years, completely worn down the cartilage. And it was, as stated, just bone on bone. We had a long discussion regarding what her options would be, and frankly, she was ready for surgery. The last cortisone injection she'd had provided very limited relief, and there was really no role for further physical therapy.
He's very conscientious, and I had no fear of surgery or anything because he went through every procedure with me and explained everything to me, and it was great.
We discussed surgery, and so the surgery she would need would be a shoulder replacement. And so that is what it sounds like, where we go in and we replace the shoulder joint. And so it's done through an incision in the front of the shoulder here. We make a skin incision that usually goes from about right here, which is the coracoid, or this bony prominence that you can feel on your own shoulder, and it goes down to pretty much the mid bicep. The approach to the shoulder goes between the deltoid and the pectoralis major. You can go right in that interval. There is one tendon we do take down in the front of the shoulder. That's called the subscapularis. That's part of your rotator cuff. We have to do that to take that tendon down to get to where the ball in the socket is. That tendon is repaired at the end of the case, and it really drives what our postoperative course rehabilitation restrictions are. But I'll get to that in a minute. And so because the patient doesn't have cartilage, we have to provide them a new joint. And the way we do that is on the humeral side, we make a cut to remove the old head. And then typically we place a stem down the shaft and a new ball on top. And there are multiple companies that make these products to resurface the humeral head. And then on the glenoid side, on the socket side, we make a new socket. And that looks something like this. And so there's typically a polyethylene component with a series of pegs that are cemented into the glenoid. And this particular company just has a central post that has a porous material on it where the bone grows into it. Some don't. But that's what it looks like with a brand new shoulder in place. And from this point, we repair the subscapularis back down to the bone, and then we close the skin. And that takes about 90 minutes or so. And it's typically an inpatient procedure. The patients are in the hospital from between 1 and 3 nights. It just depends on how things go and what the patient's comorbidities are. Age really isn't a limiting factor. It's more about the physiologic health of the patient. Or can they undergo that surgery? And most can. And so have physical therapy, see the patient the very next day, and we start using the shoulder and moving the shoulder. You're really only in a sling for about 2 weeks. There's a few things that you can't do to protect the subscapularis repair that we did at the end of the surgery. They involve external rotation and extension with the arm going behind the body and using the arm to push off of a chair or a table. Those are the main restrictions. So we get folks going pretty quickly after this, and it's a faster recovery than most patients think when they hear about having a shoulder replacement. The outcomes are outstanding, really. 90% good to excellent in the appropriately selected patients, and the implants are really quite durable. Excellent outcomes, even out to 15 to 20 years. So it's a very good operation, and Betty is quite happy with her new shoulder.
I went into surgery having pain that was absolutely, well, it was excruciating. I couldn't get comfortable. And when I came out of surgery, of course I had the after surgery things, some pain and so forth, but the pain was never like what I had before. And then in just a few days I was completely pain-free.